Now, excessive workload could have contributed to a Kent NHS doctor taking his own life, an independent report has found. Jagdeep Sidhu was a consultant heart surgeon who worked at the Darren Valley Hospital in Dartford. He died last year at the age of 48.
Well, now his brother has spoken out, saying more needs to be done to help doctors who are struggling with their workloads and feel they have nowhere to turn, because he says Jagdeep was left burned out by the just get on with it culture within the NHS. Our health correspondent Mark Norman reports.
You can see where the artery was pinched.
A leading heart consultant, Jagdeep Sidhu was at the top of his profession, working at the Darren Valley Hospital in Dartford. He featured on this BBC film, pioneering new ways of working. His family say he was a loving uncle, but last November, after kissing them goodbye, he took his own life. He was 47.
The police officer came into the room and said, this is the part of my job I really hate, and I'm very sorry to say that we found your brother's body. I just couldn't believe what had happened, and I just sat in just complete silence.
The hospital commissioned an independent report into Jagdeep Sidhu's death. Two of the factors it mentions are an excessive workload and the fact that the NHS was, as it puts it, resource constrained. Speaking to BBC colleagues near his home in Hertfordshire, Jagdeep's brother says he had spoken about the pressures of work.
He said there just simply aren't enough resources for the number of patients, and that needs to be looked at. And I think that responsibility lies outside of the healthcare system.
The hospital has told us they're committed to ensuring their staff are well supported and that they have introduced a dedicated mental health nurse specifically for staff. And they added that the report will be used to inform their ongoing emotional well-being support programmes.
I am very concerned that we've lost those spaces where doctors can come together to talk about the emotional impact of their work. Now, to be fair to the government, they're funding doctors' messes, but it's more than that. I want to see a supervision that every doctor has access to a confidential supervisor.
The BBC has learned that 18 doctors took their lives last year, 141 in the past 8 years. Amandeep is so concerned he's now set up a charity to try and raise awareness of the issue. Mark Norman, BBC SouthEast Today.
Well, the time now, it's just gone 6:45. This is our top story tonight.